The event shown below is a situation that resulted to a tissue injury and it will lead to the entry of the pathogen. And our body response would be non-specific. That is inflammation from the Latin inflammatio. And the goals would be to isolate, to inactivate, and to destroy the invaders, remove the debris, and prepare for subsequent healing. At this point, chemical mediators will be released as bacterial infection progresses. The mast cells that are being found at the bottom of the cliff will do the immune system signaling as it releases histamine and kinins. These chemomediators will lead to three important phenomena such as chemotaxis, vasodilation, and increased capillary membrane permeability. Chemotaxis will attract more neutrophils and monocytes to engage in the battlefield, while vasodilation will increase the blood flow, leading to redness and heat. And increased capillary membrane permeability will lead to vessel fluid leak that will then result to edema and pain. As vasodilation and increased capillary permeability progress, more vessel tends to leak, leading to 5 cardinal signs: the rubor, the calor, tumor, dolor, and punctuolysa. As more chemical mediators are released by the mast cells below the cliff, more neutrophils are recruited, and it leads to the yappy disease, meaning the neutrophils are squeezing out of the capillaries as is being shown, and they join and engage in the battle. Much more, they are being reinforced by the complement, which the 20 inactive plasma proteins are ready to bind and attach to any foreign cell, bacteria, or RBC to be activated and play the major factor in the fight. They amplify the inflammatory response. As the last and final stage of inflammatory process begins, other protective events unfolds, such as the pus formation, increase in metabolic rate, clotting of proteins, fibrin mesh scaffolding and walling, and all of these constitute the inflammatory process. Adaptive immunity is as of two types. One is the humoral immunity, and two is the cell-mediated immunity. This discussion will focus on humoral immunity. Humoral immunity refers to a macromolecules mediated, which can be found in the extracellular fluids. And these macromolecules is being composed of antibodies, complement proteins, and certain antimicrobial peptides. Now, in order for us to appreciate the discussion of the types of immunity, we will have to look into the role of antibodies as a major component of humoral immunity. Let's take a look and listen. Humoral immunity creates an antibody response. That is when the B cell circulates with a molecules having a 3D protein surface, antibodies. These antibodies is also called as immunoglobulin. It has an antigen binding sites where protein molecules are being folded. And only antigen with specificity can bind. This will also provide a binding site for monocytes and neutrophils. Now, when the B cells with antibody attach with the antigen, it will bind like a lock and key fit. And the B cells will then enlarge considerably. That is now we can call it as a plasma cell that is activated. And this plasma cell is an antibody manufacturer cell capable of producing 100,000s of antibodies per minute of antibody molecules. And it will produce the same antibody with the same shape and same receptor type. Now, when antibody first meet the infections or the antigen, it will produce the same pattern. It will have a 5 molecules antigen with 10 binding sites. And when an antibody will encounter an antigen, 3 phenomenons may possibly happen. If it encounters a toxins, then it may immobilize it and effectively neutralize it. However, on the second time, the macrophage or the neutrophage may attach and engulf the antigen-antibody complex. And in addition, the third is that the antigen-antibody complex may activate the complement system, from which it is a complex cascade of proteins capable of destroying the antigen. That's all, folks. This has been your nurse radiological guru saying thank you for watching and enjoy studying.